My name is Janitha Hall, and I am the specialist social prescriber for Lordswood and Ridgecre House Surgeries, which is the Quinton and Harborne PCN.
Hi, and I'm Shazia Malik, social prescribing link worker, same as Janitha, Quinton and Harborne PCN. So we're logging on to System 1 with the appointment ledger and around 6 patients booked in from 9 a.m. who we will make the initial contact with, and then we do the follow-ups for them in the afternoon. Any action that we've taken will be added onto the ARDNs on System 1. Throughout the day we will get tasks from the care coordinator and also from the GP, so we'll action them, put them into the ledger as well. Someone who's not answered the call from the previous day, so we've had to do a follow-up, so then we would then call them again. Any action that we do take, it could be a referral, it could be anything really, it could be just some information signposting, so we'll just put that in, update it on System 1. Referrals can be will come either from Janitha if it's somebody that she feels is not somebody that needs ongoing support, it's just general, then she'll refer it to me. It can come from care coordinator. If the GP is the initial person who's, after seeing the patient, thinks that they need a social prescribing input, so they will then put a task on the system for the care coordinator to pick up. And they will normally triage, and either it will go to Janitha for complex needs or it'll come to me for low-level maintenance. So that's how we receive it.
My work differs in the length of the interventions, and also obviously due to the complexity of and the nature of the referrals. So my patients normally need a lot more interventions, and you have to try and get them to engage with you first, because a lot of them are isolated, they've got mental health, the issues are very complex, and so therefore it does take a lot longer. It might take you probably 3 or 4 calls before you even get them to engage with you. So it does take a little bit more patience and effort to work with them.
So any barriers that the patient might have, it is helpful obviously if they put on there, which they do, because everything, they will normally tell us to refer to the last appointment that they've had with them, so we can get all the notes from the System 1 on that date. So we need to have the date of when they saw the GP last, because obviously in between there they might have seen the nurse, they might have seen mental health support, that kind of. So yeah, if they've got all the information on there, for us it helps. So whether it's a housing issue or whether it's social isolation, it helps us to kind of have the information in the back, so that when we do make contact with them, we know what they will be asking, what areas they're looking in for the support. So whether the patient has any safeguarding concerns, or if there's any risks concerned around that patient, that helps.
The first thing I would do is ensure that I read that task and understand it. If necessary, if there's something on there I don't understand, I would contact the referrer and ask for more clarity. Also, it's important too, as the GPs normally, they refer you to the last consultation. So ensure that I read that, and also identify the vulnerabilities that have been highlighted on that patient's page as well. If it's people who we're not to contact, those sort of things. Right, so high-risk patients, I would be looking for things like history of self-harming, suicidal ideation, those sort of things where I know that patient could be in danger, so that I'm aware of who they're engaging with, so I know which professionals I possibly would need to get the patient's permission to contact to get the history behind the situation.